And I think this introduction is really just for the 177 of us that have never been here before, because I think most other people know Jay. But Jay is the owner and principal of Want Healthcare, LLC, and he consults for a wide variety of clients, including the Network for Regional Healthcare Improvement, Centers for Medicaid and Medicaid Services, Medicare and Medicaid Services, and Robert Wood Johnson Foundation. He's the Chief Medical Officer for the Center for Improving Value in Healthcare, and he's on the board of the nonprofit Rocky Mountain Health Plan and is a commissioner on the Colorado Commission for Affordable Health Care. So you know I had to ask him a few off-the-script questions. So I asked him about his celebrity crush. Now, you could tell there was immediate recognition in his eyes. But what he says was, my wife will be in the audience. So then he went the safe route. Then he talked about he has admiration for Carly Kloss, who's teaching coding to underprivileged kids, and his daughter's going through that, and he has admiration for her. But I knew that there was there's some other name under there that he wasn't giving up. I asked him what was the first live concert he saw. Well, we start to date ourselves. He said, America. Yeah, we got some people from back in the day that know that. And then I asked him for some embarrassing moments, and he decided to tell the story about, that he, like many people with an X and a Y chromosome, have trouble asking for directions. So they were driving around San Francisco, and driving around San Francisco, and driving around San Francisco, and finally his daughter from the back seat said, Dad, do you know where you're going? And of course his answer was, oh sure, we're just taking the long way to get there. So we all have those kinds of things. I want to welcome Jay, look forward to the morning, and I'll see you all after lunch.
Thanks very much. Well, thanks a lot. So first to clarify the Carly Kloss story, my daughter's actually doing the teaching in this coding program and has had a wonderful experience this summer. So have to express my admiration and gratitude to Carly for that. Okay, so a few more factoids for the 177 of you who I have not met. Just going back to yesterday. So the 3 descriptive phrases that we each had to think of yesterday, rapper was not one of them for me. And in fact, simply the visual image is a little appalling for my wife who's in the audience, so we're actually going to move quite along for that pretty quickly at this point. The second thing is that I did give a lot of thought to the Paul Schmitz, things that Jay only realizes in retrospect that he sucks at. And truth be told, he hasn't worked on very much over the past number of years. But I only have 5 words about that. Only a half-hour show. So we actually are not going to have time to go into that, fortunately. The third one, though, is something that we can actually spend a little time talking about, which is when Karen asked people to stand up and sit down based on how long they had been coming to the symposium, I stood up and didn't sit down at 1, didn't sit down at 3, didn't sit down at 5, didn't sit down at 7. If she had gone on, I would not have sat down at 9, at 11, or at 13, because by my count, this is my 14th year in a row that I've come to the symposium. Which raises a couple of interesting questions. 1, why I keep coming back, and 2, why they keep letting me. Number 2, we're actually not going to go into because I have no earthly clue. I mean, they could have actually, this is a pretty popular conference, so they could have adjusted procedures in order to make sure that didn't happen anymore. But yet I still come back, so in the spirit of not actually drawing too much attention to that, so that if they do change the procedures, I'm going to move right on. I keep coming back because, if the truth be told, this conference has changed a lot over the years. It has changed a few different times. In that 14 years, there have been a few different pivots during that period of time. So it's hard to remember, basically, that as I began coming to this conference in 2003, the world was a very different place. And in fact, going even farther back to when I was in medical school, it was a very different place. Back then, we had kind of an orthodoxy about things. We had core beliefs, basically, that no one really questioned. And so as a medical student, day to day, this is what people told me. They told me that American healthcare is the best in the world. This wasn't anything that anybody debated. There were no kind of, if you raised your hand to say this in class, people would go, yeah, we'll take down your name and talk to you about that later. They also said that despite that bedrock conviction, there was no data about that. Medicine is this art and not a science, and all you people in the industrial engineering world, stay away. Because quality and performance, it can't be measured, much less systematically improved, and you're just likely to muck stuff up. So please don't try to improve us, because we, thank you very much, actually don't need much improvement. And then finally, in terms of thinking about health, well, it was QED. The problem is not with American healthcare. The problem is that there's not enough of it. There's not enough access to it. Those were the wars we were fighting in the 80s and 90s were for access to more and more of the stuff that we made. In essence, we can treat our way to health. So, I didn't question any of this stuff for a really long time. Went through medical school, went through residency, and went out into private practice. And then suddenly, I started to think that maybe this wasn't the way it was supposed to work. There were no courses on transportation in medical school. There were no courses on housing or food. Nutrition, of all things, we had no courses in. And I started to think, I received a fabulous education and a fabulous training, and almost none of that prepared me to take care of the most difficult problems that I see. What is up with that? But still at that time, you actually couldn't say that out loud very much. It started to remind me of that children's story. What was the name of it? Oh yeah, The Emperor's New Clothes. So American healthcare is this guy here, basically kind of walking around with nothing but the wig and the crown on, and everybody else in the background, my professors, everybody else, are the people basically trying to ignore that. I must identify with the kid in the front row who's thinking, holy moly, they usually don't let me stay up for this kind of program, and now I understand why. I can't unsee this. This is really, really bad. And then a friend of mine, Len Colm, actually said, you should come to this conference. It was called the Dorsey Hughes back then, because people there have the same kind of strange ideas that you do, and you actually might like it. So I came in, and much to my delight, and much to my relief, actually, people started whispering in my ear. Tom Reed, T.R. Reed, came one year to show us, not tell us through his videos, that the U.S. actually doesn't have the best healthcare system in the world. Don Berwick, before he was the administrator at CMS, made it okay for people to say, our system makes serious errors on a daily basis, and it doesn't have to be that way. That industrial engineering thing, it might possibly help us take better care of people. We should try that. Elliot Fisher one year came to tell us, more actually isn't better in American healthcare. His favorite joke at that time is that, true or false, you could take a third of the physicians in North America, ship them to Africa, and improve the health of both continents. You could tell what his answer was. Louise Liang, which is probably the least known name on this list, was with a large integrated health system, and she said, we as the physicians in that system decided that this is wrong. The way we do this stuff, totally wrong. They shouldn't be coming to us. We should be going to them. Healthcare should fit into people's lives, not the other way around. Probably a year or 2 years later, that organization came out with a catchphrase, a word, thrive. That's what people really want. They actually, this is going to come as a shock to all of us in the healthcare industry, but it's not very entertaining for people to see the doctor or be in the hospital or access any of this stuff. They just want to get in, get out, and move on with their lives. And then finally, and the one that's probably nearest and dearest to my heart, just because he's been an unbelievably fantastic friend for me, is the economist Len Nichols, who I also like to think of as the Right Reverend Len Nichols, who came many times to this conference to tell us, we are, in that lovely Arkansas lilt, we are morally obligated to do better, and we can. So all this was pretty crazy making, that I would actually feel crazy out in the outside world for a long period of time, and then 3 days a year I would get to come in and feel sane for a little while. And it reminds me of the closing scene from Annie Hall, in which Woody Allen tells the old bad joke, in which he said, a guy walks into a psychiatrist's office and said, Doc, I need your help because my brother, he thinks he's a chicken. And the psychiatrist says, well, why don't you just turn him in? He said, well, I would, but I actually need the eggs. And that's the way I felt about the symposium, is that I keep coming back year after year, 14 years in a row, because as much as I feel crazy sometimes in the outside world, I come here because it feeds my soul and I need the eggs. But we're in the midst of another pivot now for the foundation, another pivot in which it's like, listen, we've been pretty patient here. We've been educating you here these many years, 14 years for you, Dr. Wan, sitting in the audience. And now, it actually may be time to actually to do something. Now, to explain this side, I should say that, did I mention that one of my 3 words was geek? So this is from the Star Wars series and from The Empire Strikes Back, in which Luke Skywalker is basically practicing with his drone and with his lightsaber. He's getting beat by this machine. A lot of Yoda's quietly in the background saying, use the Force, let go. And Luke says, I'm trying, in frustration, and then Yoda kind of shakes his head and says, try. Hear you nothing I say? Do or do not do, but there is no try. Well, pretty easy for Yoda to say, because as you look at the things that we have to do actually to get to the kind of health for the state or health for the nation that we would like, it's really true. All the simple problems where it took one person or one entity to do one thing have been fixed, right? We've gotten to all those. They've been checked off the list. What we're left with is multi-stakeholder, multifactorial problems which have broad ramifications in which they cannot be contained in a single sector. It actually does take a village. And if, in fact, we all work together like this Amish community to do barn raising, to do a thing that no single individual in the community could do by themselves, it probably would go pretty well, right? But all of you who have tried this, it actually probably feels a little bit more like this, right? It turns out building villages is a really difficult task, actually. As you look to the center of the picture, you are here, right? And the people on the other end I like to think of as the people you may have beat out in the last RFP, who you really hope basically don't trip, sneeze, or God forbid decide to take a lunch break. Cooperation, collaboration seems to be hard these days in America. It's a really kind of difficult thing. Well, I did what I usually do when I'm faced with that challenge, because again, the theme for today, the theme for this conference, the theme for everything really around these 3 days is the will to act. And so, as my friend Jane Brox likes to say, somebody knows about this. And so if you go online and you Google this, eventually you'll come to Robert Putnam. So Robert Putnam wrote a book called Bowling Alone, and for a while was the dean of the Kennedy School of Government at Harvard. And he explored this basically through his entire career. And in his writings are a couple of things. There's good news and there's bad news. The good news is the central idea of social capital, in my view, is that networks and the associated norms of reciprocity. I do something for you, you do something for me, I forgive you, you forgive me, have value, i.e., we are able to create as communities things that individuals cannot. We are able to build things, we are able to raise barns, we are able to create community in a way that single individuals, even in this magnificent age of individual empowerment, there are still some things that communities can do that individuals cannot. That's the good news. The bad news is that Robert Putnam documents a secular decline in social capital over the last half of the 20th century, and I would bet extending into the 21st century. This is one of his graphs, and he has lots of graphs that look like this. They actually all look almost the same. So this happens to be average membership rate for 32 national chapter voluntary associations from 1900 to 1997, almost all of the 20th century. He likes to call them the animal organizations. So it's the Elks Lodge and the Moose Lodge and the Kiwanis Club. I have no idea what a Kiwanis is, but essentially this is social civic activity. This is joining together. And these graphs all look the same for the time that he's plotted it for. There's a rise from the beginning of the century through World War I into the roaring 20s, and then a dip during the Great Depression. This is correlation, not causation. Theories are maybe people hunkered down. But then as we get to World War II, it takes off again, reaches this kind of pinnacle on a plateau into the 1950s, the age of the company man. And then beginning around 1960, we see a slow but steady decline through the remainder of the century. So if your parents or grandparents have stories about how this worked better back in their day, they may not be remembering it wrong. It may have been easier. Another one of the statistics I really like out of Putnam's work is that in 1970, each of us on average went to about 5 picnics. Now it's about 2, right? The tendency to come together, to get together, basically to enjoy and even revel in our need for one another has actually declined through the latter half of the 20th century and into the 21st century. Against that backdrop also, even though I don't have a graph for that, but just from my own experience, there's been a growth basically of individual empowerment. Not a bad thing, not a bad thing at all. The fact that you all basically tweeting out there can reach tens, hundreds, thousands, maybe tens of thousands of people as your tweet is retweeted is a magnificent demonstration of individual empowerment. Those two trends, I think, while they may not be in opposition, run roughly counter. Well, maybe those people are right. Maybe the people will say the whole thing is about individual empowerment. The key to and the answer to all of our problems basically is that we just need to empower everybody, and then everybody in a free market can actually get the stuff that they need. Well, again, reading helps me a lot on this stuff, and so this article came out in the Journal of the American Medical Association in JAMA in April. Very, very timely for this talk. And a little shout out to Sarah Porter-Osborne and Kim Rivich, who actually obtained these slides and the permission to use them from Dr. Chetty himself. So Dr. Chetty and his colleagues at Stanford, MIT, and Harvard actually did something that sounds relatively prosaic, and thus the title, The Association Between Income and Life Expectancy of the United States, 2001 to 2014. Really smart guys, and actually this is actually more of a minor miracle than you would think. They went through 1 billion records. Now, 1960, you're not going through 1 billion records. 2016, you can go through 1 billion records and correlate them because they both have Social Security numbers on them, right? And figure out that, lo and behold, you're right. The richer you are, the longer you live. Big deal. Well, turns out to be a big deal because there also are addresses on that and zip codes in those 2 records. And what they discovered was this. Let me take a minute just to go through this because this is pretty central to this argument. So y-axis is life expectancy at age 40 in each of these locales. X-axis is basically household income in ventiles, 5% chunks basically, from the lowest 5% to the highest 5%. And you can see the relative incomes underneath that. If you go to the right of the median, what you see is that the 4 curves for Detroit and Dallas and San Francisco and New York, there is not very much difference at all. This is for men, basically, in this period of time. But as you go to the left of the median, boy, those curves start to diverge. And in fact, they get to be pretty big gaps by the time you get to the last ventile. For the lowest quarter, the poorest, basically, the lowest 25% of income, as reported to the IRS, there's a 6-year difference between the best and the worst of our cities, the best and the worst of our commuting zones. If we go to women, the curves look almost exactly the same. The gap for the lowest quartile is 5 years rather than 6 years in this particular graph. But you can see where you live matters, particularly if you're poor. If you're wealthy, I would speculate, and I can't prove because this is correlation and not causation, I would speculate that you can compensate for all manner of other insults basically to try to preserve your health because it's pretty important to you. But if you're poor, it makes a big difference what surrounds you. What is your environment? Chetty goes on basically to, so here's the really interesting question. After figuring out that context matters, that community matters, that where you are matters in terms of how long you live, and that capital that we talk about in terms of lifespan, as an outcome that we really, really want for everybody, an equal opportunity to have that go on as long as they would like. He starts to look at what are the determinants, basically, of that. So he goes to, and we're just going to go through the ones that are underlined, since those are the big categories. Don't have time for everything. But health behaviors, to the surprise of almost nobody in this room, is really, really important. Places where, so to the left of the line is lower lifespan. To the right of the dotted line is longer lifespan. To the left, you see places where people smoke more and where there's higher rate of obesity, people live less long. Places where their self-reported exercise rate is higher, they live longer. But look at all the categories down below that, all the big headers. Healthcare. Giving people more healthcare doesn't make people live longer from place to place. That is not a determinant according to Chetty's work. Environmental factors. Close to the zero line actually doesn't make that much difference. One of my favorite theories going into this, inequality and social cohesion. Basically, my thought was, well, if people could band together, they could actually stand the insults that come from the outside world and also from the inside world, from the diseases that they carry with them. Turns out, not that great a determinant for the people who are poor. And then finally, for those people who say, the only good thing we're ever going to do for people's health is get them a job, turns out not to be right in Chetty's work. Unemployment rate, change in labor force, none of those things actually explain the difference between places where people live longer and the places where people live less long. These are other factors. And so these are all community factors as well. And these were all positive predictors of lifespan, of places where people live longer. Percent immigrants. I'm going to pause here to have you imagine the sentence that I'm not filling in as the son of immigrants at this point. Median home value, basically, where basically the community in and of itself is richer. Local government expenditure. This is the reciprocal tax rate. If you bring in more money in your local community to build, roads, bridges, schools, community health centers, you might actually do better if you're poor, if you live in a place that has devoted those kinds of resources to that. And conversely, probably less well in places where they do not devote resources to that. Population density, and very much to Dr. Anderson's points later on, education. In communities where there's a higher graduation rate into college, from college, the poor live longer. Well, the whole theory that this is all going to be about individual empowerment and that communities actually don't matter that much anymore, Chetty's not buying that. He says the strong association between geographic variation in life expectancy and health behaviors suggests that policy interventions should focus on changing health behaviors among low-income individuals. Taking more care, giving more health care to the wealthy, to the middle class, if your goal is basically to improve the health of your town, of your city, of your county, if your goal would happen to randomly be to create the healthiest state in the nation, the money's not in taking care of the wealthy and of the middle class. The money is actually in changing health behaviors among the poor. That's where the yield is. That's where cold, hard economic, and these are people that my friend Nichols would say, these are seriously boring economists. I mean, basically this is real hard data. The money is actually in affecting that particular population. Well, let me put that together with the fact that we're making a pivot here. And what we're left with here is a really big ask, right? Joining the movement's a pretty significant ask. And so to talk about that in particular, I default to one of my favorite newspaper writers, which is David Brooks from the New York Times. And around Memorial Day, he wrote a piece called Big Love. He defines little love as the people kind of in our immediate field of view, our family, our friends, our coworkers, and big love being the people who are outside of that, but that we may never meet, but that we oftentimes, hopefully spend a significant amount of time and effort thinking about and hopefully benefiting. And this is what he has to say about big love. Big love involves thinking in sweeping historical terms. But today, the sense that America is pursuing a noble mission in the world has been humbled by failures and passivity. The country feels more divided than unified around common purpose. Big love involves politics and thus compromise, competition, and messiness. Americans today are less likely to discern the noble within the grittiness of reality. The very words that the founders used to describe their big love for their country sound archaic. Glory, magnanimity, sacred honor, and greatness. There is in some less animated desire in the country at the moment, and therefore less energy and daring. There's a spiritual and a cultural element behind these trends. So I write today in defense of big love. The love not only of your little platoon, but of the grand historical project this country represents. Young people now want to join startups or NGOs or eat locally grown food, but I'm writing in defense of the big love that once inspired big projects like NASA, the national railroads, and the creation and maintenance of the post-war American-led world order with the free movement of people, goods, and ideas. Before the country can achieve great things, it has to relearn the ability to desire big things. It has to be willing to love again, and here the emphasis is mine, even amidst disappointments. To love things that are awesome, heroic, and sublime. So, while none of us would actually want to, thank you. Well, none of us would actually want to surrender our little loves, those places that we go to find people who can see the best of us, see our best selves, even on the days when we cannot see it in ourselves. None of us want to surrender that. What I suggest today is that if we actually do aim to create health, if we aim to do things on that scale with that kind of bigness, that kind of scariness and also awesomeness, that we probably have to get together again, that we actually probably have to rebuild the shining city on the hill, where we struggle through all the messiness, and then, as opposed to what we may have been doing in the past several years, throwing up our hands when we feel opposed and frustrated with people who can't speak exactly the same dialogue that we can, that we might have to admit, even amidst disappointments, persevere in order to be able to create that once again. I have to laugh a little bit because, you know, somebody yesterday closed with Margaret Mead and John F. Kennedy, both quotes that I really love, by the way. Mine actually comes from a different source. Anybody recognize this actor? So this is Christopher Lloyd, okay? And you might think with the geekiness thing that I'm going to go back to Doc Brown. I'm actually going to kind of feint left and go right and actually say that the quote that I'm going to close with is actually from Taxi. This is pre-Uber. This is a series in the 1970s for you young folks. And into the early 80s. And his first appearance in the show is actually a wedding scene because he plays the, you know, slightly kind of stoned out hippie street preacher, Jim Ignatowski. And he's called in basically to perform this wedding in the Taxi garage. And so with apologies basically to Christopher Lloyd and to James Brooks, who originated the service, I now bring you and this is to avoid copyright violation, I now bring you the wedding speech from Taxi. We are gathered here today to join these two people in marriage. He's talking about marriage, but I want you to think community when I say that. The question often arises in our time, why marriage? The answer is hard to see, but as easy as a heartbeat to feel. We marry to have a friend, a lover. We marry to deny solitude's cold hands on us. We marry because after exploring all the alternatives, we still want to and need to and must. Ladies, thank you. What I'm suggesting to you that we've been on a long, basically, course over the last 50 or 60 years in which individual empowerment has been a great and wonderful thing, giving voice to people who otherwise would not have voice. There is nothing bad, and there is nothing wrong with that. But, you know, as a physician and a guy who likes to tinker around my house, I recognize that there's some things where you need the right tool for the right task. And I fear that in our national dialogue, we have decided that that will save all. Simply giving voice to everyone and empowering everyone, and that basically it obviates the need for us to cooperate with one another and to try to build something big again. It is my sense that, in fact, that after exploring all the other alternatives, that we can and must return to community because we want to and we need to and we must. We have a fabulous lineup for you. We have people basically here who I think will inspire and allow us to soar in that and hopefully to emulate their example. And I'm really excited to be able to introduce them in just a second. But let me indulge, if you will, indulge me one more minute to thank you for your kind attention. You've been very kind in listening to me this morning, as you have every time I've taken this stage. And I especially want to thank you, basically, for allowing me over the last 14 years to be a member of this community. Thank you so much.